So first we're going to ask about the main symptoms. First we're going to ask the woman about the main symptoms of menopause. So urogenital period history, including age of menarche, timing the periods came on, when any heavy or bleeding, excluding any red flags for bleeding, any sweating or sleep disturbance, any mood or brain fog, any musculoskeletal symptoms, and a past gynecological history, and consider a vaginal exam. Also consider the impact the ice and the might have on their sexual life or on their ability to do day-to-day tasks. Notably, in their past history, you want to know, do they have the uterus intact? And do they have any other, as I said, red flags for, you also want to know about their bone health, their cardiovascular history, any headaches with aura, any endometriosis, any abnormal LFTs, or any dysfunctional uterine bleeding that hasn't been diagnosed, any family history of breast cancer. Next, we want to consider diagnosing menopause. So if they're under age 45, you can consider some blood tests for FSH and LH. However, if they're over 45, you don't need to do that. You need to use clinically. Remember in your history to go through the contraindications, including family history, cancer, VTE, and cardiovascular disease, migraine, or any liver problems. And also remember to ask them about contraception in their history as well. Remember that we can use targeted treatments up to, like venlafaxine, up to 150. We can use Vagifem applicators or Invagis. Remember about non-hormonal and lifestyle, people using sage and over-the-counter supplements. Consider cyclical versus continuous progesterone. Basically, if they are having, I'll make that different color. This. They're having bleed or non-bleed, or they need to have a withdrawal bleed. Consider the benefits under 60, or they bone and reassess their symptoms, and then continue to assess the risk of breast cancer and VTE. If they have bleeding on HRT, which is a different ball game, let's just call this bleeding on HRT. Bleeding in different